A hazard is any situation that poses a threat to life, health, property, or the environment. Biological hazards, or biohazards, are biological substances, specifically medical waste, microorganisms, or samples, that threaten the health of living organisms. In clinical and research laboratories, these threats take the form of specific physical materials encountered during daily operations. These sources include all specimens of blood, cerebrospinal fluid, and concentrated viruses such as HIV and HBV. Managing these biohazards requires a quantitative discipline, matching biological threats with equal and opposing physical containment systems. Because we are dealing with invisible, self-replicating threats, containment relies on a physical architecture designed to eliminate the specific pathways of exposure. Engineering that architecture begins by quantifying the threat using a foundational metric of biological risk, the infectious dose, or ID. The infectious dose is the specific number of microorganisms required to successfully cause an infection in a host. This scale shows that pathogens do not pose a uniform threat. The logarithmic variance in ID requirements dictates the necessary level of containment. High ID pathogens, such as Escherichia coli and Salmonella, require a massive exposure, between 1 million and 100 million individual organisms to establish an infection. Step down to medium ID threats, and pathogens like Vibrio cholerae or the spores of Bacillus anthracis require only tens of thousands of organisms to compromise a host. Extremely low ID pathogens represent the highest acute danger. Shigella dysenteriae and Mycobacterium tuberculosis require 10 or fewer microscopic organisms to cause disease. This math is also influenced by host susceptibility. A compromised immune system dynamically lowers these ID thresholds, making the host more vulnerable to smaller quantities of pathogens. A threat requiring fewer than 10 organisms cannot be managed by basic hygiene alone. It requires an engineered environment with zero tolerance for exposure. Even a low ID pathogen requires a physical pathway to enter the host. These pathways are categorized into direct contact, such as droplet spread, and indirect contact, such as airborne transmission. Pathogens typically exploit standard physiological routes of entry, the respiratory, gastrointestinal, and genitourinary tracts. In a laboratory, the most critical danger stems from unnatural routes, pathways opened up by artificial breaks in the mucous membranes or the skin. This is the exact moment a physical barrier fails, instantly turning a contained hazard into an active, dangerous exposure. These unnatural routes are usually the result of mechanical failures, including accidental needle punctures, centrifuge accidents, and cuts from contaminated glass. Because human error and mechanical failures create unpredictable pathways into the body, safety protocols are engineered as physical, foolproof barriers. The primary strategy for physical containment involves the strict management of regulated medical waste, or RMW. RMW is any medical product that comes into contact with blood or other potentially infectious materials. Even minor contact automatically classifies the item as regulated waste. Treating all RMW as a single category is a system failure. The waste must be stratified based on its physical properties to ensure it is neutralized effectively. The World Health Organization uses a global color coding scheme to manage this waste stratification. The yellow bin is designated for highly infectious waste, anatomical body parts, and items such as bandages or gauze soaked in body fluids. The red bin is for contaminated plastics, such as catheters and IV bottles, and syringes that have had the needles removed. The blue bin holds all types of glassware, broken glass articles, and discarded medicines. The black bin is a dedicated, puncture-resistant container strictly for sharps, the needles and scalpels capable of creating unnatural routes of entry. Liquid biohazardous waste requires an additional engineering layer, collected in leak-proof primary containers placed inside secondary vessels to prevent spills. Stratification physically separates distinct threats, such as sharp metal versus fluids, so that the correct destruction method can be applied to each specific stream. The ultimate goal of this pipeline is decontamination, the complete removal of pathogenic microorganisms from an object. Decontamination is split into two technically distinct methods, disinfection on the left and sterilization on the right. Disinfection uses strong chemicals like alcohol or formaldehyde to kill many microorganisms. However, it leaves bacterial spores viable and dangerous. Mild antiseptics used on the skin, such as chlorhexidine, operate under this same principle. They prevent growth or kill some organisms, but they do not achieve complete biological neutralization. Sterilization represents the total elimination of all microorganisms, including the highly resistant spores that survive chemical disinfection. Sterilization requires intense physical forces. In an autoclave, 121 degrees Celsius heat and 15 pounds of pressure physically disintegrates pathogens over 30 minutes. Other methods include incineration for pathological waste or gamma radiation for disposable equipment like needles and syringes. While disinfection manages surface probabilities, only the thermal, chemical, or radiological physics of sterilization ensures the biological threat is truly neutralized. The laboratory functions as an engineered machine designed for containment. The system starts by identifying the exact infectious dose of the pathogen on the benchtop. We anticipate the vectors of transmission and physically block any unnatural routes of entry into the host. We capture the threat in stratified WHO waste bins based on its physical state. Finally, we apply the extreme physics of sterilization to ensure nothing survives the loop. Biosafety is the successful application of physical and chemical forces to counter a biological threat, reducing the mathematical risk of transmission to zero before any waste ever leaves the facility.